The heavy human cost of the coronavirus pandemic is laid out in the latest official figures. They show that in the week ending the 10th of April, the number of deaths in England and Wales was double the level normally expected and the highest level for 20 years. During that week, there were 18,500 deaths registered in England and Wales. More than 6,000 of those deaths, that's roughly a third, were linked to coronavirus. And in that same week, the number of deaths in care homes quadrupled as care providers describe the difficulties that they face. As for the latest daily figures, 823 people died in hospitals across the UK in the last 24-hour period. We will be examining the direction of those figures in just a moment. But first, our social affairs correspondent, Alison Holt, has the latest on the impact of the pandemic.
Each face so much more than a statistic. A life lived, a family mourning. The extraordinarily high toll of deaths in the official numbers today can only really give a glimpse of how much the coronavirus is taking from us. Among those it's claimed is 89-year-old Joan Davis.
My mum could ask her about something that happened when she was a child, and Auntie Joan would be able to give you the day and the time and everything that happened. She had an incredible memory for things like that. Yeah, she was a great historian for the family.
Her niece says although Joan was frail, she was still doing well at her care home in Wales. Her ambition was to reach the age of 100, but within a couple of days of developing COVID-19 symptoms, she had died.
I do wonder, if people really understand how much we're going to lose in terms of the older communities. So much experience and family loss will happen because we're not really looking out for them properly. We're certainly not looking out for the carers either, and that's really scary.
And many care homes, like this one in Sheffield, have been hit hard by the virus. The deaths of some of their residents have left staff at full stretch physically and emotionally. A week after she last spoke to us, their boss says they're coping but have felt on their own.
Sadly, we're the forgotten sector. I think we don't have the infrastructure or the support of the NHS, so I would say that we've needed that. We really have needed this over the last 4 weeks, and I think we've got to look at lessons need to be learned from this.
Official statistics are only now starting to give a sense of the impact of the virus in care homes in England and Wales. The last figures up to the start of April recorded the deaths of 217 people as linked to COVID-19. Today's figures show a week later that overall number had quadrupled to more than 1,000 deaths. That means 10% of all deaths connected to the virus are in care homes. The figures in Scotland and Northern Ireland are higher. The majority of deaths are still happening in hospitals, but whatever the setting, COVID-19 doesn't explain all of the increase in the number of people dying.
So we're hoping in a few weeks' time to have a better idea about what those excess deaths are and how they may be interplayed with those different settings, how much of them may actually be a COVID-related issue, how much of them may be actually where people are not going to hospital, where perhaps they would have done in the past. So how much of this may be due to other factors as a result of lockdown.
The government has promised more help for care homes, but wherever a person has spent their last hours, today's numbers are an upsetting reminder of the reality of coronavirus. Alison Holt, BBC News.
So it's time to take a closer look at some of today's figures and to ask what signals they provide. And Fergus is with me, Fergus Walsh, our medical correspondent. This raft of data and figures today, what trends are you detecting?
Well, Huw, 823 deaths today, a huge jump, but many of those will have occurred over the weekend and in previous days. Now, for the first time tonight, we have an accurate picture of the trends in deaths in English hospitals on the day they actually happened. And that gives us some hope for optimism amid all the grim statistics. Now, if we look at those, we can see that there was a steady rise in deaths, which seems to have peaked on the 8th of April. And then since then, it has been falling. Now, a word of caution on this, the last 5 days on that chart will have some deaths added to that in the coming days. So they will go up. But the trend there is clearly down. Now, if we go to that peak, that probable peak on the 8th of April, those people would have probably been infected around 3 weeks before, on average. And that's just before the lockdown, when people were being told to avoid pubs and restaurants and work at home. And then we had the lockdown and we saw the dramatic effect that that has had.
We can also say something today and shed some more light on the situation in hospitals, specifically this time in England, Wales and Scotland. Yes, we have. Now, we've gone from a peak of over 20,000 people in hospital with COVID-19 in Britain to around 17,600. So still a huge number, but we've brought on some selected areas from the government chart, and we can see from that, well, you can see London, that seems now definitely to have peaked there and is coming down. The other areas, Midlands, Scotland and Wales, well, they haven't fallen, but they're levelling off. But there's still a lot of work to do there, and it's all dependent on social distancing continuing. Fergus, once again, many thanks. Fergus Walsh there for us, our medical correspondent.